This is a patient with gastric outlet obstruction caused by a very large liver metastasis pressing on the pyloric channel duodenal bulb area. We initially treated this with a duodenal stent placement, but this did not resolve his symptoms of gastric outlet obstruction. This is the area where the stent ends and it turns into duodenal sweep location. So we treated this with EUS guided gastroenterostomy using AXIOS 20 mm by 10 mm fully covered metal stent placement. We first placed a long 035 jag wire through a 10 French nasojejunal tube and then advanced the tube over the guide wire into the jejunum. And then the scope is withdrawn while pushing the nasojejunal tube without creating any loops in the stomach. Dilute contrast mixed with saline and methylene blue is irrigated through the tube and visualized on fluoroscopy as well as EUS scope. Nasojejunal feeding tube can be seen here on EUS exam in the lumen of the intestine, and further irrigation leads to good distension of intestinal lumen. Then the AXIOS stent catheter is advanced towards the gastric wall and then connected to the cautery. First step on the cautery pedal leads to traversing the gastric wall. A second tap on the cautery pedal makes the AXIOS stent catheter traverse the duodenal wall, and it finally enters the duodenal lumen. Once the catheter enters the duodenal lumen, we do not use cautery any further to prevent damage on the contralateral side of the duodenal wall, and then the stent is inserted further into the duodenum without use of any cautery. At this time, the internal flange is deployed. Then the stent catheter is pulled towards the gastric wall to create a dumbbell shape. And then the gastric side of the dumbbell is deployed into the scope lumen. Sometimes we try to advance a guide wire through the AXIOS stent into the duodenal lumen to maintain guide wire in case if a stent maldeployment occurs. Then the view is changed to the endoscopic image. At this point, while we push the stent in, we gradually look away from the gastric wall with the endoscope to make a room for the gastric side of the flange, and the stent is fully deployed. You can see the saline mixed with methylene blue coming into the gastric lumen from duodenal side, and bile can also be seen coming into the gastric side. At this time, we carefully pull the AXIOS stent catheter out of the stent, and we also remove the guide wire. It is not necessary to dilate the stent lumen, but sometimes dilating the stent lumen allows to better examine the other side of the stent and make sure that there is no contralateral damage. Here you can see the endoscope entering into the duodenal side. There is no cautery related damage on the duodenal mucosa, which can be seen here through the stent lumen. At this time, excess liquid is aspirated and the procedure is completed. We typically keep patient NPO for 3 to 4 hours after this procedure and start with clear liquid diet. The diet is advanced to soft diet over next 2 to 3 days, but patient is usually able to go home the same day after the procedure. This patient had full resolution of his symptoms of gastric outlet obstruction